Okay, this is the demonstration for D1 lower extremity flexion and extension of the hip. First, starting off with D1 for going into flexion, you would start first with the hip extended, abducted, and internally rotated, with the knee already being extension and the tibia externally rotated, with the ankle plantar flexed and everted, and the toes flexed. Now, when you begin to go into flexion, it starts off as you would tell the patient it would be a pulling maneuver because you're pulling the hip towards their body. When you go into flexion, you'll begin to flex the hip, bring it into adduction with the hip being externally rotated. The knee will be flexed and the tibia will be internally rotated as well. With the ankle, when you're pulling it into flexion, you would want to dorsiflex it and invert it, with the toes being extended instead. Now, going the other way, going into the opposite way, the pushing maneuver into extension for D1 extension, you would then first start with the hip flexed, adducted, and externally rotated, with the knee already being flexed, the tibia being internally rotated, the ankle being dorsiflexed and inverted, and the toes being extended. When you're bringing it into extension, it's as if it's a pushing maneuver because you're going away from the body. You're going to bring the hip into extension, into abduction, and internal rotation, with then the ankle being plantar flexed and everted. So when you're bringing it out, you'd want to bring the ankle out, plantar flexed and everted, and you would also have the knee extended with the tibia externally rotated. Now, for D2 flexion, you would start first with the hip extended, but this time adducted, with it also externally rotated, and the knee would already be in extension with the tibia externally rotated, and the toes with being flexed, and then the ankle would start plantar flexed and inverted this time instead, which is different from D1. Now, when you're bringing it into flexion, it's again a pulling maneuver because you're pulling it towards the body. You're going to bring the hip up into flexion, except this time abducted and internally rotated, with the knee already flexed, the tibia internally rotated, and the ankle will now be dorsiflexed and everted this time instead, with the toes being extended. Now, for D2 going into extension, it'll again be a pushing maneuver because you're pushing away from the body. And this time, you'll start with the hip flexed, abducted and internally rotated, with the knee already being flexed, with the tibia internally rotated, and the ankle already dorsiflexed and everted from this position. Now, when you're bringing it into extension, you extend the hip, adducting it this time, and keeping it externally rotated, with the tibia externally rotated, bringing the knee also into extension, and the ankle and the toes will now be in a plantar flexed and inverted motion. So when you're bringing it into extension, you'll plantar flex and invert it, bringing it towards the body for D2 extension. And that is the demonstration for D1 and D2 lower extremity for the hip.